Another day, another video of first aid by treating hemorrhoids, self-care, diagnosis and treatment. Hemorrhoids are a common condition that affects millions of people around the world. They occur when the veins in the rectum and anus become swollen and inflamed, causing discomfort and pain. While hemorrhoids can be a source of embarrassment, they are not usually a serious condition, and there are several self-care measures that can help alleviate the symptoms. Diagnosis of hemorrhoids. The first step in treating hemorrhoids is to determine whether you have them. Hemorrhoids can be internal, which means they are located inside the rectum, or external, which means they are located around the anus. Internal hemorrhoids are not visible, while external hemorrhoids can be seen as lumps around the anus. To diagnose hemorrhoids, your doctor may perform a physical exam and ask you about your symptoms. They may also perform a digital rectal exam, which involves inserting a gloved finger into the rectum to check for any abnormalities. In some cases, your doctor may also recommend a colonoscopy or sigmoidoscopy to rule out other conditions. Self-care treatment for hemorrhoids. Once you have been diagnosed with hemorrhoids, there are several self-care measures that can help relieve the symptoms. These include over-the-counter medications. Over-the-counter medications can be very helpful in providing relief from the discomfort of hemorrhoids. There are many options available such as creams, ointments, suppositories, and wipes. These medications can help to reduce inflammation, provide soothing relief from itching and burning, and can also help to reduce swelling. In addition, there are also lifestyle changes that can be made to help reduce the symptoms of hemorrhoids. Increasing the amount of dietary fiber in your diet can help to reduce the incidence of constipation, which is a major contributor to hemorrhoidal symptoms. Additionally, regular exercise can help to improve circulation and reduce the pressure on your veins. Finally, be sure to practice good hygiene by cleaning the area gently and avoiding harsh soaps or wipes. These measures can help to reduce the symptoms of hemorrhoids and provide quick relief. Warm baths. Warm baths are one of the most effective self-care treatments for hemorrhoids. Sitting in a warm bath for 15 to 20 minutes can help to reduce the swelling and irritation associated with hemorrhoids. This can be done several times a day, or as needed, to provide relief. Additionally, adding a small amount of salt or baking soda can help to soothe and reduce inflammation. After a warm bath, it is important to pat the area dry, rather than scrubbing it. This helps to prevent further irritation. In addition to warm baths, other self-care treatments for hemorrhoids include using a topical cream, avoiding straining during bowel movements, and eating a balanced diet. Proper hygiene. Proper hygiene is a key part of hemorrhoids self-care. Keeping the area clean can help to prevent the risk of infection, which can worsen the condition. This can be done by gently cleaning the area with warm water and a mild soap after every bowel movement. Additionally, patting the area dry with a soft cloth can help to keep the area dry and reduce irritation. If wiping with toilet paper is uncomfortable, using medicated wipes can also help to keep the area clean and free from bacteria. Fiber-rich diet. A fiber-rich diet is essential for hemorrhoids self-care. Eating foods that are high in fiber helps to prevent constipation, a common cause of hemorrhoids. Fiber helps to soften stools, making them easier to pass. Foods that are high in fiber include whole grains, fresh fruits and vegetables, legumes, nuts, and seeds. Eating a diet that is rich in fiber is a simple and effective way to help prevent and reduce the symptoms of hemorrhoids. Increased water intake. Increasing water intake is an important part of hemorrhoids self-care. Adequate hydration helps to soften the stool, reduce constipation, and reduce the strain on the veins during bowel movements. It is recommended that you drink at least 8 8-ounce glasses of water each day to keep your body properly hydrated. Additionally, increasing fiber in your diet can help to bulk the stool and decrease straining during bowel movements. Including foods that are high in fiber such as vegetables, fruits, and whole grains can help to maintain regularity and reduce the risk of hemorrhoids. When to seek medical attention. While self-care measures can help alleviate the symptoms of hemorrhoids, there are times when medical attention may be necessary. You should seek medical attention if your symptoms do not improve with self-care measures. You experience severe pain or bleeding. You have a fever or chills. You have difficulty passing stool. You notice a lump or swelling around the anus. In some cases, your doctor may recommend prescription medications or surgical procedures to treat hemorrhoids. These may include rubber band ligation, sclerotherapy, or surgery to remove the hemorrhoids. Home remedies. Manage your bowel movements. Hemorrhoids can be exacerbated by straining during bowel movements. Therefore, it is important to manage your bowel movements carefully. Avoid straining or holding your breath during bowel movements. Instead, try to relax and let things happen naturally. You can also use a stool softener or a fiber supplement to help ease bowel movements. Use cold compresses. Applying cold compresses to the affected area can help reduce swelling and pain. You can use a cold pack or a bag of ice wrapped in a towel. Apply the cold compress for 10 to 15 minutes at a time, several times a day. Soak in warm water. Soaking in a warm bath or sitz bath can also help relieve hemorrhoid symptoms. The warm water helps to increase blood flow and reduce swelling. You can also add Epsom salt or other soothing ingredients to the bath water for added relief. Keep the area clean. Keeping the affected area clean is important to prevent infection and irritation. After bowel movements, gently clean the area with moist wipes or a soft cloth soaked in warm water. Avoid using harsh soaps or other irritants. Wear comfortable clothing. Tight clothing or underwear can aggravate hemorrhoid symptoms. Wear loose, comfortable clothing and cotton underwear to allow for air circulation and reduce irritation. Use over-the-counter creams and ointments. There are several over-the-counter creams and ointments that can provide relief from hemorrhoid symptoms. Look for products that contain ingredients such as witch hazel, hydrocortisone, or lidocaine. Stay hydrated. Drinking plenty of water and other fluids can help soften stools and prevent constipation, which can aggravate hemorrhoids. Aim for at least 8 to 10 glasses of water a day. Hemorrhoids are a common condition that can affect anyone at any age, but they are more common in adults over the age of 50. The condition can be caused by several factors, including constipation, straining during bowel movements, sitting for long periods, pregnancy, and obesity. Self-care measures are usually the first line of treatment for hemorrhoids, and they can be effective in relieving the symptoms. However, it is important to note that these measures may not cure the underlying condition, and they may need to be used in conjunction with other treatments to achieve optimal results. Over-the-counter medications, such as creams, ointments, and suppositories, can help reduce inflammation and relieve pain and itching. These medications usually contain ingredients such as hydrocortisone or witch hazel, which have anti-inflammatory properties. Warm baths, also known as sitz baths, can also help relieve the symptoms of hemorrhoids. Sitz baths involve soaking the anal area in warm water for 10 to 15 minutes at a time. This can help reduce inflammation, improve blood flow, and promote healing. Proper hygiene is also important for preventing further irritation and infection. You should avoid using harsh soaps or wipes, and instead use mild, fragrance-free soap and water. After a bowel movement, gently clean the area with a moistened toilet tissue or a baby wipe, and then pat the area dry. A diet that is high in fiber can also help prevent and treat hemorrhoids. Fiber helps soften the stool and make bowel movements easier, which can reduce the risk of constipation and straining. Good sources of fiber include fruits, vegetables, whole grains, and beans. In addition to these self-care measures, there are several other treatments that may be recommended by a doctor, including prescription medications, rubber band ligation, sclerotherapy, and surgery to remove the hemorrhoids. These treatments are usually reserved for cases where self-care measures have not been effective, or the hemorrhoids are severe. In conclusion, hemorrhoids are a common condition that can cause discomfort and pain, but they can be effectively treated with self-care measures and other treatments. If you experience symptoms of hemorrhoids, it is important to seek medical attention to ensure that you receive the appropriate treatment. With proper care, most people are able to manage their symptoms and prevent further complications. Thanks for watching.